Hey everyone, Dr. Dimon coming to you with a new Myopia Matters video series. In today's video, I'm going to talk about orthokeratology and wrap up our talks on that specific treatment. Specifically today, we're going to talk about the studies. We're going to talk about how well does it work, what are the risks and benefits, and should we be concerned about this type of treatment. First and foremost, looking at how well it works. There was a meta-analysis of 16 different studies, and a meta-analysis means that they combined 16 studies and looked at statistics to try to come up with one common number or recommendation. And by doing that, they found a 50% reduction in myopia with this treatment. And what that means is you take a child who's a -1, they're going to be a -10 if we do nothing. We might keep them at a -4 or -4.5. And that prescription difference can make a huge difference for that child, for their life, for their visual issues, and just to reduce the risk for eye health issues. Some people feel that that number is on the low end because a lot of these studies are a little bit older, and since these studies have come out, there's been some custom designed products where you can actually control certain parameters of the lenses, and by doing that, we can actually maybe give a better control to that child. And I definitely truly believe that in some of our kids, we've been able to do greater than 50%, maybe even upwards of 90%, but that's not proven in studies, so I don't want to throw that out there in full and stand behind it 100%. So if we do that, what should we be concerned about the risk? So first, can children wear contacts? There was a study done, again, another meta-analysis of studies is by a gentleman named Mark Bullimore, and he found that children 8 to 12, 13 to 17 had no higher risk for infectious issues from contact lenses. We call it infectious keratitis or microbial keratitis. Those are the serious vision loss type infections that people can get from wearing contacts. And so what he showed was younger kids or adolescents had no more risk than adults. And if we look at the risk, okay, just with contacts, but then specifically with Ortho-K where you wear a lens at night, the risk of contact lens, so a daily contact lens causing infective keratitis was 2 in 10,000 years. The risk of a monthly daily monthly contact, which is a silicone hydrogel material, higher oxygen material, was about 12 in 10,000 years. And the risk for Ortho-K in these studies was 13 in 10,000 years. So when you look at those numbers, it's not any more at risk than a child wearing a monthly contact, which they take out every night. Now, some people will say these studies are flawed. They'll say the data is not true, we're not getting accurate data, but it is the data we have. And if everything's done the right way, it can be a safe treatment for those patients. With that being said, our biggest worry when we fit a child in Ortho-K is infective issues, microbial keratitis. And that is why every patient we strongly discuss at high levels how to clean their lenses, how to take care of their lenses. We give them my cell phone number. We have them text me and call me if there's any issues. And we're on top of that so we can prevent those issues. There are, obviously some patients who aren't going to follow the rules either way, and there's some doctors who probably aren't as specific as we are. So what we try to do is if we feel that Ortho-K is the best for that patient and the parents agree, or it's one option we want to choose, then we try to do everything we can to minimize that risk at the highest level, obviously, because we take that very seriously. The one thing when you look at it though is what is higher risk? Them having progressing nearsightedness or myopia versus an affective disease. The studies show that if a child progresses past a -5, then their risk is actually 4 times more likely to suffer vision loss from myopic maculopathy, so changes to their macula from being highly nearsighted, than they are from having an infection from Ortho-K if they use that treatment. Another study showed that if a child is between a prescription of -3 and -6, they have equal amounts of risk with a retinal detachment as they do of having an infective keratitis. So again, when we just make these decisions for these kids, we have to decide what is the best treatment, what is going to increase the risk, how can we minimize the risk, and also if we just let the kids go, what is the risk that they can have that way too. And maybe that's when we look at other treatments, such as atropine and multifocal contacts, which are valid treatments. And again, you have to use all the tools in your toolbox. And there's not one set treatment for each kid. It's just not the way it works. And so if you go to a doctor that uses one set thing on everybody, that's not individualizing or customizing that for that child. And maybe it does work. Maybe there's a treatment that could be better. And that's what we try to do at the Myopia Matters Club. Okay, thanks guys for hanging on to this video. I know it was a little long and a little more winded and a little more detailed. Next video, we are going to start talking about multifocal soft contacts, which I'm really excited to talk about. There's been a new lens that we've just added. We were just approved as a MiSight provider, which is only FDA approved treatment for myopia. So we are providers of that. Plus we use another lens called Natural View. So we'll talk about those details in the next video. Again, be well, take care. If you have any questions, please reach out to me personally, and like our page, share our page, go to our YouTube channel, and just follow us to stay up to date on all this stuff. Okay, hope to talk to you guys soon. Thank you. Bye.